About what the long-term results of sciatica, our sciatica treatment are. I have a new TV, and apparently my arms are not long enough, so I have my spine here just in case I need it. So we're going to talk about what the long-term effects of our treatment are, because that question comes up a lot. If I get the treatment, what are the long-term effects? Why do we do these videos? We do these videos for several reasons. One is because we're different. We have a process, a protocol, and a procedure to eliminate back pain and sciatica without drugs or surgery, and we treat the most complicated back problems that are out there, and they get better. We have a research article that's recently been published that identifies our treatment as the best for these types of problems. Doctors are not obligated to report the results, so you don't know what the results of specific treatments are. Our goal is to give you some transparency, but also our goal is to help you make better healthcare decisions by understanding what good outcomes are. So today's case is a 58-year-old male who had back pain and sciatica, and he had it for 5 years. Now, he's case study 138. And I know that we are closing in on the 1,000 mark. We should have it by Friday, and we're going to have a little celebration because that's kind of a big deal. But we're on case study 138. 5 years of back pain. And just remember, if you have back pain and sciatica, this number here tends to be more important than most. The longer you have the problem, the more wearing out of the discs and the spine you will have. So this is an important number. So a patient 58 years old had back pain and sciatica for 5 years. Comes and goes, but he had it for 5 years. It was getting worse and worse and worse and worse and worse. Okay, during that time he saw several other doctors, had an MRI, and continued to go through physical therapy. Okay, he would maybe get a little bit better, but the problem didn't go away. So he'd been suffering for 5 years. That's the key here. The key is the 5 years. So we have a 9-step process. And our 9-step process is specifically designed to, number one, educate you about your back problem. Also, step number one for us when you come in is to evaluate your discs. Sciatica is a disc problem, so we evaluate your discs, and then we formulate a treatment plan for your problem. Now, here's one of the keys. If you get the proper diagnosis and you get the proper treatment, the problem goes away. Any health condition you have to have the proper diagnosis and you have to have the proper treatment. How do you identify the proper treatment? The proper treatment is identified by what are the outcomes, what are the results. Most of it is not available readily because nobody's held accountable for their outcomes, but some of it's in the medical literature so you can identify what is considered best. So we put him through the 12-step process. We identified that he had spondylolisthesis, degenerated discs, bulging discs, and sciatica. So he technically had 3 of the 5 reasons of sciatica. We have a video on that. If you haven't seen the video, watch that video. But we just had a conversation earlier. What we're going to do is we're going to do a half-hour piece, a half-hour video really about all the anatomy and what happens to the anatomy and why you have the problems you have. Because again, when you understand why you have the problem, it's easier to treat it. And you're more likely to follow through with the procedures. Just like we did yesterday, we did the tips. The tips are very important because there's a reason that you have to sit up straight, okay? Because you get that sort of the stretching of the ligaments, okay? You get the creep, you get the ligamentous creep, and that overloads the disc. So there's a reason for all this. So he had 3 of the 5 reasons causing the pain that was going down his leg, which is sciatica. Okay, sciatica is a symptom. It's not a cause. People say, oh, I have sciatica. Well, what's the cause? What's causing your sciatica? It's important to know what the cause is. It's a pinching of the nerve. The symptom is the nerve is being pinched. The cause is the disc, or the cause is the degenerated disc, the bulging disc, and or the spondylolisthesis. Now, this tends to be the most complicated problem you can have when you have sciatica. It's the wearing out of the vertebrae where you get the shifting. Looks just like this. Boy, this is hard. So what happens is the vertebrae shift one on top of the other. They're not aligned. They should be aligned. One moves a little bit. When it moves like that, what it does is it starts to pinch the opening where the nerve comes out. Starts to pinch these little nerves right in here. Okay. Again, this goes back to how long does the treatment last. So he had a pretty complicated problem right here. Also had a degenerated disc. Vertebrae get closer together, start to pinch the nerve. Degenerated disc. Very common form. He had a bulging disc. Okay, bulging disc is sort of the beginning of the herniated disc. His disc had not herniated yet, but he had the bulging disc, which was kind of like having a flat tire. And he had the degenerated disc where the tire had been wearing out, and he had the shifting of the vertebrae. So he had a lot of wear and tear. The key to back problems is wear and tear. So he had all these problems going on. Now, when he came in, here's what he had. He had sciatica. His pain, his back pain, his leg pain was an 8. His oswestry was a 58. 58 is high. Okay? The oswestry disability index is one of the main forms of understanding how disabled you are from your back pain. We call it a patient-reported outcome. Patients report, this is what happened. I had this procedure, here's my beginning oswestry, here's my ending oswestry. How much disability did you have before you started? How much did you have at the end? That is outcome. That difference between where it was when you started and where you were at the end, that is considered outcome. So we know he had a 58. 58 is considered severe, almost crippling. Okay, a severe disability. Okay, patients in this category, absolutely 100% candidates for surgery. Anything here and above, you are a candidate. Sometimes in this middle zone here, you can be a candidate for surgery, but this area right here, absolutely 100% candidate for surgery. A lot of patients choose not to have surgery. They come to see us. He was a surgical candidate. Why? Because he had a 58 and he had a pinching of his nerve. Okay? Started therapy at an 8, started oswestry at a 58. At the end of therapy, his back pain sciatica was a 2, his oswestry was a 16. Our goal is always to get you down below a 20. Okay? Anything below a 20 is considered the safe zone. So that was after treatment. So we do the evaluation right after the treatment, and he says, yeah, I'm down to a 16. And then what we do is we follow up to say, all right, how are you doing? How are you doing? So we followed up with him 3 years after the program. After he was done with therapy for 3 years, didn't do any therapy in between ours and the 3 year when we called him. And what we found out was his back pain had gone all the way down to a 0. His sciatica had gone all the way down to a 0, and his oswestry had gone all the way down to a 0. So he actually continued to get better after he left our program because we gave him exercises. These are his sciatica exercises. We gave him sciatica exercises. That's what I'm trying to say. So we gave him the exercises, and 3 years later, what happened? Gone. Didn't come back. Again, he'd suffered for 5 years. So the question is, what is the long-term benefit? Long-term benefit is out of pain, problem didn't come back, able to live his life with 0 disability. Okay, he was 0 disability. Remember here, he was a 58. He was, in this area right here. Severe disability, almost crippled. Okay, closing in on this zone right here. So, had a severe problem, we got him better. What's the long-term outcome? Long-term outcome, his pain went away, did not come back. 0s. Okay, we affect the disc. Why is our treatment different? Because we affect the disc. I call it the evolution of back pain. A lot of back pain was treated by physical therapy, which is muscles, or chiropractors, which is the joints. Okay, we do the muscles, the joints, and the disc. By doing all 3, you get better. Why are our outcomes better? Because it's different. Okay, it's the evolution. We've evolved now to where we can treat the disc. It used to be we could only treat the muscles and the joints. Now we treat the disc. That's what makes ours different. That's the one thing. And if you have a disc problem, you have to get a disc treatment. The only other disc treatment of choice available to you very often is surgery. And the outcomes for surgery are not good. And the consequences, sometimes long-term consequences, are you get addicted to Oxycontin, oxycodone, and narcotics, because that's typically the drug of choice post-surgery. Okay, that's it for today. That's all I'm going to say about that. Okay, we have a better option. It's effective. If you like our information, please subscribe to our YouTube channel. Our goal is to help you make better healthcare decisions and know what to do when you're having a problem. What exercises, what stretches, what postures. These are all very, very important things, and we have these every day on YouTube. So that's it. I'm done for today. Be good, be safe, subscribe to our channel. We'll see you tomorrow. Thank you very much.